Hi, everyone, and welcome to Scaling Up Your Impact. I'm Kelly Smyth-Dent, today's host, and I want to talk today about something that has really transformed my clinical practice. We call it the stepped care approach to mental health. So, I've been thinking a lot about how we approach trauma treatment compared to emergency medicine. It's actually kind of fascinating when you think about it. When someone comes into the ER with a serious injury, what's the very first thing the medical team does? They stabilize the patient, right? They stop the bleeding, they monitor the vital signs, they make sure that the person isn't in immediate danger. And only then do they move on to deeper treatments or surgery. But what about in mental health? We often do things completely backwards. A client comes in clearly dysregulated, maybe experiencing flashbacks or panic attacks from trauma. And what do many of us do? Sometimes we dive straight into exploring childhood wounds or processing traumatic memories before ensuring their nervous system can actually handle that kind of work. I've seen this play out so many times, both in my own early practice with supervisees, and even with more experienced clinicians. Clients get really overwhelmed, sometimes drop out of therapy or even leave sessions more dysregulated than when they came in. And we wonder why trauma therapy can be so challenging. That's exactly why I'm passionate about the stepped care approach that's been developed and refined over time by organizations like mine, like Scaling Up. It gives us a structured, thoughtful pathway for trauma treatment that prioritizes stabilization before deeper work begins. So think of it as bringing the wisdom of emergency medicine into our mental health practice. So today I'm going to walk you through each step of this model from stabilization techniques to assessment and planning, all the way to advanced interventions for complex cases. Whether you're a fellow clinician or just someone interested in understanding mental health treatment better, I think that you'll find this really illuminating. Okay, so let's start with step one, stabilization. This is absolutely crucial, and honestly, it's the step that we're most likely to rush through or skip entirely in traditional therapy approaches. So, what exactly do I mean by stabilization? Well, it's about helping clients regulate their nervous system and stay within or return to their window of tolerance before attempting any deeper therapeutic work. The window of tolerance is such a useful concept, created by Dan Siegel. It describes that zone where we can function effectively, where we present, engage, and are able to process information and emotions. When we're within this window, we can think clearly and respond thoughtfully rather than just react. But trauma and chronic stress can dramatically narrow this window, making it harder for clients to stay regulated. Outside of this window, clients either experience hyperarousal, feeling anxious, panicky, or overwhelmed, or hypoarousal, feeling numb, disconnected, or shut down. And here's the thing, when clients are outside of their window of tolerance, therapy that involves processing difficult materials simply isn't as effective and can sometimes even be harmful. So I remember working with a client, we'll call her Maya, who had experienced a car accident and was having intrusive memories and panic attacks. In my earlier days as a therapist, I might have jumped straight into processing the accident, but instead, using the stepped care approach, we spent several sessions just focusing on stabilization by using grounding techniques. And also specifically, I use the ASSYST intervention to re-regulate her nervous system first and expand her window of tolerance. Oftentimes, this can be done in just one session. So, ASSYST stands for Acute Stress Syndrome Stabilization, and it fills the gap between basic psychological first aid and more intensive trauma treatments like EMDR therapy. What I love about the ASSYST is its flexibility. It can be used within hours, days, or months after a traumatic event, or during ongoing stressful situations. It can be delivered individually or in groups, in person or online, so it's super flexible. And it doesn't require clients to verbally recount their traumatic experiences in detail, which can sometimes be re-traumatizing. So instead, the ASSYST focuses on regulating the nervous system by addressing the sensory and somatic components of the traumatic experience. So it helps reduce immediate intrusive symptoms and expands the client's capacity to handle distress. Now, here's an important point. For many clients, stabilization techniques alone might be sufficient to facilitate healing. So, some research on the ASSYST has shown that about 90% of people who receive the ASSYST in a group format don't require further individual treatment. For others, stabilization creates the essential foundation for deeper work. Once clients can regulate their emotions, stay present during sessions, and have expanded their window of tolerance, they're ready for step two of the step to care approach. So think of it, some clients come to you because they want to do the deeper work. In that case, the ASSYST might be great as preparation for that deeper work. But some clients come to you because they're in immediate crisis. They're not necessarily interested in doing the deeper work. They just happen to be seeing you because they had a recent traumatic event. In that case, it might be that the clients just need to do that stabilization work and then move on with their life. They don't necessarily want to do the deeper work. So that might be where you're seeing some of that difference in the 90%. Okay, so let's talk about step two, assessment and treatment planning. Once a client has achieved basic stabilization, we move into step two. Again, this parallels what happens in emergency medicine after initial stabilization. The medical team conducts a thorough assessment, runs tests, and develops a comprehensive treatment plan. In mental health terms, this means conducting a full evaluation of the client's history, symptoms, strengths, supports, and challenges. We're looking to understand not just the presenting problems, but also the underlying patterns and potential sources of distress. This is where we determine whether the client would benefit from the additional interventions beyond the stabilization techniques already provided. Some clients might be ready to complete therapy after stabilization, while others need more intensive treatment. The treatment planning component involves mapping out a structured approach to therapy, establishing clear goals, and identifying the most appropriate interventions. I always make this a collaborative process with my clients, ensuring that the plan aligns with their priorities and readiness for change. For many clients who have experienced trauma, EMDR therapy emerges as a recommended next level treatment during this phase. So EMDR stands for eye movement desensitization and reprocessing. It's an evidence-based approach specifically designed to process traumatic memories and reduce their emotional impact. So what makes EMDR particularly valuable in the stepped care model is its structured protocol. It includes its own built-in stabilization phase before processing begins, reinforcing the importance of preparation and resource building before addressing traumatic material. So through EMDR's eight-phased approach, clients can process traumatic memories that were previously overwhelming to their nervous system. The bilateral stimulation used in EMDR helps the brain process information differently, allowing traumatic memories to be stored in a way that reduces their emotional charge. So I've seen amazing transformations with clients using this approach. One client who had experienced childhood abuse and had tried numerous therapies over the years told me that EMDR helped her feel like the memories were finally, quote unquote, just memories, rather than experiences that still felt happening in the present moment. So it's kind of like putting your hand right in front of your face versus reaching out further. The memory is still there, but it's not right in front of your face where you can't see past it and it's bugging you all the time. It's sort of just an unpleasant memory that's further in the distance. That's the effect of EMDR with clients. But it was through stabilization work that we did first that made the EMDR processing so effective. For some clients, standard EMDR sessions will be sufficient to address their needs. Others with more complex presentations may require additional support, which brings us to step 3 of the stepped care approach, advanced care. Step 3 focuses specifically on advanced care for complex cases. So, to continue our medical analogy, this is comparable to ICU level care or specialized surgery. Intensive interventions designed for situations where standard treatments aren't sufficient. In mental health, complex cases might include clients with developmental trauma, multiple traumatic experiences, dissociative disorders, or comorbid conditions that complicate treatment. So these clients often benefit from specialized approaches that go beyond standard therapy protocols. So scaling up offers two primary advanced care options within our framework. We offer the EMDR-GAP training and the EMDR intensives training. These are EMDR advanced trainings for people who have already gotten the basic training. The EMDR-GAP training stands for Group, ASSYST, and PRESSI, three powerful protocols that you learn in the training designed to address various trauma presentations. The group component refers to the EMDR integrative group treatment protocol, which allows therapists to provide EMDR therapy in a group setting, reaching more people simultaneously. This is particularly valuable in community settings or after large-scale traumatic events where individual therapy for everyone might not be as feasible. I've seen this used effectively after natural disasters and in community mental health settings where resources are limited, such as refugee camps. The ASSYST component, which we discussed earlier, provides stabilization techniques, while the PRESSI protocol, which stands for the EMDR protocol for recent critical incidences, addresses both recent traumatic events and ongoing traumatic stress, along with prolonged adverse experiences. So this specialized training equips therapists to work with complex presentations using a stepped care approach. It's particularly valuable for addressing situations where clients are experiencing ongoing traumatic stress, in addition to single incident traumas. So when I say prolonged adverse experiences, I'm talking about first responders, domestic violence, abuse. Imagine a client who experienced sexual abuse as a child. Then in college, they had a single rape incident. And then when they were in their marriage, they were experiencing domestic violence and sexual assault was a part of that. So when you look at that case, there are multiple different sexual assault incidences throughout that person's life, in addition to whatever other complex trauma situations they have. So as the therapist, you're often feeling pretty overwhelmed looking at all of those different targets, as we call it in EMDR, to focus on. So the EMDR PRESSI protocol allows you to actually target all of those sexual assault experiences as one target in a way that we consider this sort of bite-sized pieces, making it more manageable for both the client and the therapist as you're setting up that target. So it basically simplifies that complex presentation in a really powerful way for both the therapist and the client. Another advanced care option that we teach at Scaling Up are EMDR intensives, concentrated treatment periods where clients receive multiple hours of EMDR therapy over consecutive days rather than weekly sessions. This approach can accelerate healing for clients who aren't progressing with standard weekly sessions or who need more focused, in-depth processing. So EMDR intensives might involve several hours of therapy per day for anywhere from 1 to 5 days. This immersive approach allows for deeper processing of traumatic material without the week-long gaps that can sometimes interrupt momentum in traditional therapy schedules. So I remember working with a client who had experienced complex trauma and was struggling with severe PTSD symptoms. We decided to try an EMDR intensive approach, and over 3 consecutive days of longer sessions, he made more progress than in the previous 6 months of weekly therapy. The continuity and depth of the work made a tremendous difference in his healing process, and it also helps the clients who can easily get destabilized, stay stabilized because you are there to help contain them when they get dysregulated versus, you know, taking a deep dive into EMDR and then stopping for a week and then taking a deep dive for an hour and stopping for a week. Sometimes that can be more dysregulating than staying in the EMDR session all day and getting the SUD down to a 0 or lower or closing out targets within that day, which naturally re-regulates and stabilizes the client. So these advanced interventions require additional training and expertise from therapists. They represent the highest level of care within the stepped care model and are reserved for cases where standard approaches haven't been sufficient or where the complexity of presentation requires more specialized treatment. So, what makes the stepped care approach so valuable for mental health practice? I think it comes down to a few key points. So, first, it provides a structured pathway from stabilization to advanced interventions, ensuring clients receive the appropriate level of care based on their needs and their readiness. By prioritizing stabilization before deeper trauma work, we create safer therapeutic experiences and potentially prevent re-traumatization. Secondly, it optimizes resources. Not every client needs the most intensive treatments. Some might achieve significant healing through stabilization techniques alone, while others benefit from the full spectrum of care. This helps us allocate our clinical resources more effectively and ensures clients don't receive more intervention than is necessary. It also gives agency back to the client. For those that don't necessarily want to do all of the deep work, they have one particular purpose that they want to get out of therapy and they don't want to do the rest. So it gives them their agency back to decide what level of treatment and care they want to receive at that time. Third, it gives clinicians a clear framework for decision making. Rather than guessing whether a client is ready for trauma processing or trying to figure out why therapy isn't progressing, the stepped care approach provides clear guidelines for assessment and intervention planning. So I encourage all mental health clinicians to reflect on their current practice. Are you prioritizing stabilization before deeper therapeutic work? Do you have a structured approach for determining the appropriate level of care for each client? How might incorporating elements of the stepped care approach enhance your effectiveness? For those interested in deepening their skills in this area, Scaling Up offers comprehensive trainings in each component of the stepped care model, from the ASSYST for stabilization to EMDR basic training to specialized advanced EMDR protocols for complex cases. These trainings can equip you with the valuable tools to enhance your practice and better serve your clients. We also have a membership program called The Collective that you can join with a variety of CE courses and additional trainings where you don't need to be an EMDR trained clinician in order to join and get support from our community, be able to answer questions and engage with experts in real time, and not go through this process alone, but to create community. As our field, we can oftentimes feel very isolated. We've created The Collective to create more community within the mental health space. So remember, just as emergency medicine prioritizes stabilization before deeper intervention, we can create more effective mental health treatments by ensuring clients have the regulation skills and nervous system stability that they need before processing traumatic material. It's about meeting clients where they are and providing the right intervention at the right time, not rushing into deeper work simply because that's what we think therapy should look like. So thank you for joining me today on Scaling Up Your Impact. To learn more about us, go to scalingupemdr.com. I hope this exploration of the stepped care approach has provided valuable insights for your practice or your understanding of mental health treatment. We'll see you next time.